Hello dear friends, VedaPulse company welcomes you and I am translating on behalf of Dr. Elena Archibasova, and today our webinar is about syndrome called anemia, and as usual in the beginning we give its definition. Anemia is clinical hematological syndrome which is manifested by decrease in the concentration of hemoglobin and the number of erythrocytes in the blood. All the cells in our body are divided into red and white blood cells, and today we will talk about red blood, which is represented by erythrocytes, as you can see them on the slide, and hemoglobin that is contained in these cells. There are many types of anemia, but each kind shows the reduction of erythrocytes and hemoglobin. Here is the illustration of how blood of a healthy person looks like with normal amount of erythrocytes on the left and blood of a person with anemia on the right. Let's look more closely at red blood cells. It is the biggest group of blood cells, and here on slide is what should be normal amount of them in the body for men and women. Women have lower number, and this is absolutely normal. Generally the number is indicated in trillions, and the difference between men and women is explained by physiological peculiarities of the male body. First of all, its androgens and testosterone. Their main function is stimulation of erythrocytes maturation, which is called erythropoiesis. Female hormone estrogen influences the process less. Second of all, its physiological peculiarities of female body, which is monthly loss of blood. You see that hemoglobin number is indicated in grams per liter because we're talking about its concentration. And male is higher than female. And as you can see on the illustration, hemoglobin is usually located inside erythrocyte. If we talk about anemia and we said it's the reduction of red cells, what are the criteria for it? Here are World Health Organization instructions on hemoglobin concentration for men and women. If the number is less than what you see, then it could be a sign of anemia. There's also several types of anemia severity. It can be light, moderate, or severe. Anemia is diverse clinical hematological syndrome, and here is the general classification of it. Anemia can have different causes. It could be primary disease or consequences of some chronic illness, for example, pathological manifestation of some gastrointestinal disorder. It could be according to pathogenesis or mechanisms of disease development, for example, post-hemorrhagic. Anemia that is caused by bleeding due to injury or some chronic bleedings. It can be hemolytic. Hemolysis means destruction of erythrocytes, which can happen due to hereditary factors when the numbers of erythrocytes reduces. It could be dyserythropoietic, which is connected with erythrocytes dysfunction. Anemia is also differentiated by blood type. It can be normoblastic and megaloblastic. The latter means that bigger in size erythrocytes are producing blood which is not normal and which is not good. So it's very important to understand the reasons of anemia and treat the problem. The reason we're talking about anemia today and the reason why we chose it is because it's a very topical problem in our modern life. And let's look at some of the statistics here. As we see, a lot of people to some extent have iron deficiency, and since iron is the main component of hemoglobin, without it there is no normal function of erythrocytes. That's why around 5 billion people have signs of anemia. 5 billion out of all 7 existing now on Earth. What are the reasons for developing iron deficiency anemia? There could be several reasons. First of all, it's processes connected with iron absorption. Since we consume iron from food, there's a very complicated process of its absorption and distribution to the blood cells and hemoglobin synthesis. It's connected with different pathologies of gastrointestinal tract and can lead to iron deficiency. Second reason is blood loss, mainly to some chronic bleedings. For example, ulcerative process in intestines is followed by constant bleedings. Excessive women period is also a reason, and alimentary factor, which is connected with insufficient intake of iron, which can be due to some restricted diet. What happens to iron when it gets into our body with food? First of all, it is digested in intestines, and presence of hydrochloric acid plays a big role for its absorption, and we know that this acid is one of the main components of gastric juice. When there is secretion dysfunction due to atrophy or some other reasons, it leads to iron incomplete absorption. Many factors connected with work of gastrointestinal tract influence iron absorption, and internal causal factors helps to digest it. After digestion in intestines, iron gets to blood and is distributed by transport protein transferrin in the body. Most of iron gets in the red spinal brain and hemoglobin synthesis in it. Some part is stored in liver and spleen, and some goes toward muscular system. What is iron function and what amount of it is in the body? Average person weighs 70 kilos and there's up to 4.5 grams of iron, most of it in the blood. And why do we need iron? First of all, because hemoglobin participates in breathing activity, hematopoiesis, enzyme reactions, and restoration reactions. Deficiency and impaired iron metabolism can lead to anemia. Here you see red blood cells. They are round, but they're also biconcave. There's a reason for such shape. It increases the volume of surface that touches the oxygen, and this cell contains hemoglobin and ferrous iron. We breathe atmospheric air that has 20% of oxygen, and this oxygen is binded in the lungs with hemoglobin, saturates it with oxygen, and creates oxyhemoglobin. The latter, due to constant movement of erythrocytes, reaches every cell of our body, so the main function is transport function. If amount of transport elements is reduced, if hemoglobin concentration is lowered, then there is less oxygen in cells, which leads to cell hypoxia. Here are the main pathogenetic mechanisms that are in the base of every anemia. Iron deficiency anemia is extreme sign of iron deficiency. And anemia doesn't happen at once, it is a gradual process. First type is pre-latent iron deficiency, and here on top you see iron storage, in between there's transport form of iron, and lower part is iron in the blood. With the pre-latent deficiency, blood test numbers stay normal. Transport iron also doesn't change, but there is depletion of storage amount of iron when body starts using what was saved for later. Next stage is latent deficiency, and first picture is normal amount. Second is iron deficiency state, when there is no iron storage left, when iron transport factor is disturbed, and there is no clear external signs, and in blood tests the erythrocytes and hemoglobin numbers are within limits still. The last stage is iron deficiency anemia, when there is no iron storage, disturbed transport iron, and there are changes in blood tests and also the clinical picture of anemia. Now let's talk about trophic changes. What are they? It is changes that do not show up on lab tests. First of all, it's worsening of skin and hair condition, thinning of hair starts falling out, it turns gray, then nails change their color and form, they flatten, there are cracks in the corner of the lips. Those are early changes that will not show anything atypical in blood test. Iron deficiency itself has clinical proof in the form of reduction of erythrocytes and hemoglobin. The symptoms will be changes of skin color, it turns pale, and the changes of mucous tissue. First of all, conjunctiva. It becomes bluish white. Oral mucosa becomes pale, skin becomes dry, person starts to have dyspnea and breathe heavily. If the cell has lack of oxygen, it starts working worse, it starts to exhaust quicker, and person is often tired, and there could be muscle weakness. One of the signs is fast heartbeat or tachycardia, disturbance of heart rate, changes of the stool, in severe cases fainting, and pronounced disorders in cardiovascular system. All these are clinical manifestations of anemia. Since we're talking about iron deficiency, then we need to understand that we only get iron from food. And here on the slide you see what is the normal intake of iron per day. Man needs around 10 milligrams, woman 15 or 20 milligrams. It is connected with physiological state of a woman. And during pregnancy, the iron intake is increasing twice in the second part of pregnancy. And here's the food that is rich in iron, and two moments need to be considered here. First of all, the quantity of iron in the product, and second of all, or I would say it's the primary, the bioavailability of iron. Because in products the iron can be of two types, heme and non-heme. Non-heme iron is hardly digested in the body. So food rich in iron are animal products, red meat, liver, cereals like buckwheat, beans, fruits, vegetables, and nuts. Dried mushrooms have the highest content of iron. Then beef liver is around 20 milligrams, coca, beans, strawberry, and beef itself has only 2.5 milligrams. Apples and pears are high in iron, cucumber, and even squashes. The leader is beans, it's between 10 and 20 milligrams per 100 grams. Sunflower seeds and rye bread. Second component that we mentioned is iron bioavailability. Heme iron, which is in animal products, has better bioavailability than non-heme iron from plants. Heme iron is digested for 40–50% in best case. Iron from cereals is only digested for 10–15%, and from vegetables and fruits it's 5–10%, and dairy products up to 5%. Vitamins of B group like B1, B2, and B12 facilitate iron absorption, and for example B12 you can only find in animal products. Also vitamin C and vitamin PP, and the latter has two forms, and one of them is known to almost everyone. It's called nicotinic acid. Ascorbic acid or vitamin C increases bioavailability of iron. If you add this vitamin to your food, it will increase iron absorption up to 30%. For men, the normal intake is 100 milligrams. Women 80 milligrams, and if a person has intensive work, then it can come up to 500 milligrams per day. Proteins of animal nature increase the ability to iron digestion. Iron absorbing best of all is in red meat, liver, chicken, and fish. Now these are the components that deteriorate iron absorption, such as oxalic acid and tannins. So products like spinach, sorrel, apple queens will block iron in the body. I also want to mention calcium because iron and calcium are competing between each other, so excessive amount of calcium stops from good iron absorption. Next factor is problems with gastrointestinal tract, insufficient concentration or synthesis of hydrochloric acid. Strong tea has lots of tannins, and that provokes bad absorption of iron. Soy protein fiber products contain phosphates and phytins, which together with iron create non-soluble complexes that prevent iron absorption in organism. And first of all, it's products like wheat products and dark leafy greens. So right now we just talked about academic scientifically proved factors, and now let's switch to Ayurveda and traditional Chinese medicine. In Ayurveda, anemia is called Pandavoga. It is interlaced with academic factors, And anemia is the insufficiency of the blood in terms of the quantity and quality, and is one of the disorders, the blood emptiness or distress of Ranjaka Pitta with Vata type constitution. We have a seminar by Dr. Alexa Rogin about constitutional types and blood stagnation, and you can find this information on our site and get the link to the video. From a Ayurvedic point of view, anemia can develop due to insufficient on raw nutrition, alcohol abuse, or some tastes like pungent, sour, or salty. Their excessive amount increases pitta and influences blood state. Also, anemia can be due to injuries, which is called hemorrhagic anemia, also pregnancy, heavy menstruation, and other severe bleedings. Also, one of anemia reasons is iron deficiency, as we said, and from Ayurvedic point, this can be caused by dairy vegetative diet, because these products have iron, but its availability is very poor. I mean bioavailability. Also, intake of different drugs or intense physical activity. So what treatment does Ayurveda suggest? First of all, it's diet therapy, and meat eating is one of the factors here. To restore our iron, organism needs to receive ferrous heme iron, which is only contained in animal products. It could be soups with meat broth, some sesame seeds, also pomegranate juice, and black grapes. Anemia condition can be determined by VedaPulse tool, and here we will look at some of the evaluating factors. First of all, it's cardiointervallography or Dosh's balance. We said that anemia is the blood emptiness syndrome for Vata Pitta constitution, and you can see this imbalance on the illustration. Next slide is organ pulse. Combination of several meridians is important here. Firstly, you can see insufficiency of third and fourth meridian, spleen meridian. Because Ranjaka Pitta is out of balance, it is also liver meridian, which is in tension, and one more is insufficiency of 12th meridian, which is kidneys. Next one is Nidana subdosha, and here we can see some typical signs of iron deficiency anemia. First, it's imbalance of the main Vata subdosha, Apana Vata. Next is tension of Ranjaka Pitta, which is liver. Avalambaka Kapha is also insufficient. Since Kapha is the criteria of liquid sphere and shows the decrease in blood hydrating level or blood emptiness. Next marker is Nidana Dhatu or tissues. First is tension of Radha Dhatu, second is Majja Dhatu. On first screen shot it's tense, and in the second one it's in depletion state. When there is iron deficiency without clinical manifestation, body tries to compensate this condition by hyperregeneration or hyperfunctioning of hematopoiesis, and this is shown on the first screenshot, and second one shows that disease has a chronic state. Next slide is combination of first elements with Vata Pitta constitution and blood emptiness syndrome. Here we see imbalance of Vata Pitta. Ether is dominating, air and fire is subdominating, earth is always low, and water decreases. It is the classical picture of anemia for Vata Pitta type. I also would like to say some words about our company's new development, which is new module for Veda genetics, and here is how it looks. It allows you to test genes and determine their state according to constitutional types and their common diseases. It also allows people to find out predispositions to a number of other illnesses. Also, a person can collect his biomaterial, which is epithelium, the inside of the cheek, and then send it to us. And we will do gene analysis and give descriptive conclusion on lifestyle, diet, physical activity according to the condition of the genes. And this is all I wanted to tell you today. And thank you for your attention, and please send your requests to our email address. Goodbye.